Dr. Jay Wyatt from Cone Health is back with us for one more segment, talking all things COVID and the state of the pandemic. This question from a viewer says, okay, here it goes. Is wiping down things still suggested? Isn't COVID spread by the air, not by what you touch?
It's spread in both ways. So yes, wiping down contact areas is still very important.
Kind of like during cold and flu season, you always wanted to wipe down like the door handles and that kind of thing.
Anything that's been contacted, especially if it's someone that you know has been COVID positive or is COVID positive.
All right, so this next question is, do you need to be boosted to be fully vaccinated?
Yes.
That is a quick answer. Yes, fully vaccinated means that you've had all your vaccines plus your booster. All right, this next question is, if you think you were exposed, when should you get tested?
So I think that I know that if you become symptomatic, you should go ahead and get tested. Generally, that can happen anywhere between 2 to 4 days after the exposure. If you never become symptomatic, it's not required that you get tested, unless someone, external body, your employment or travel, is asking that question. But otherwise, you don't need to get tested unless you're symptomatic.
Okay. What is the most important data to track? I try to keep up with the numbers by myself, this person is saying.
In terms of moving out of this and moving forward?
Yes.
Probably the positivity rate in the community. I think it's come down, like I said, to about 5%. When we get below 2%, we will be in a much better state.
This person is saying, is there a waiting period between the vaccine and the booster?
I didn't hear that clearly.
Is there a waiting period between the vaccine and the booster?
Yes, there is. Generally, at least 3 weeks.
So 3 weeks is probably the safe time between the vaccine and the booster for that.
Yeah, I believe so. It could be longer, but I know that it is at least 3 weeks.
All right, and then this question kind of piggybacks on that. How soon after being sick can you get vaccinated? So if you got COVID, how soon afterwards should you get your vaccine or get your booster?
It's anywhere from 4 to 6 weeks.
4 to 6 weeks if you're sick. After that, that's when you should do it. All right, so this next question is there any data about blood clots from the vaccine?
There's information to show that the ability or the tendency to form clots is increased slightly, but not to a point where it negates the benefit of the vaccine.
And if you have that, are there certain people maybe who might be predisposed to that should be talking to their physician about that before they get the vaccine or the booster?
And they generally will talk to their physicians about that beforehand and weigh the risks versus the benefits. Most of those people who have those tendencies are already on medications that mitigate against clotting.
Will we always have to isolate after getting COVID?
The isolation or quarantine period is decreased, and it really somewhat depends on the severity of the disease, whether or not you're immunocompromised. In general, for most people, the isolation period is about 5 days.
This person is asking, is it true that Omicron is less severe than the first round of COVID? So
anecdotally, it does seem to be less harmful than the original, but we still are having people who have severe disease and who have died from Omicron.
I still think folks are sometimes hesitant to go to the emergency room or to the doctor with COVID. So when do you go to the emergency room, no questions asked?
So anytime that you're terribly ill or that you feel very sick, you should go to the emergency department. I would not delay any severe symptoms or going to see about severe symptoms because of concern about COVID. The ERs are prepared to handle patients with COVID and those without COVID and keep them separated so the risk of any type of contact transmission is exceedingly low. So if you feel as though you're sick enough, go to the ER. Do not go to the ER just to get tested, however. We have plenty of other sites to get tested. There's some through Cone Health, and there are also those home kits that we talked about earlier.
We have just about a minute, but this person is asking, if the booster wanes over time, kind of like the vaccine, why don't we need a 4th shot yet?
That's what we're trying to determine now, is whether or not we will need a fourth shot, and actually moving forward into the future, will we need some type of repeat immunization yearly or every 6 months, such as what we're doing now for influenza?
Okay.
Those are questions still being asked.
And those questions will be answered coming in the next couple of months, just like we've answered so many other different kinds of
Well,
COVID.
it may take a little bit longer than a few months. It might take several months or years to answer those questions about long-term immunization.
Oh, good to know. All right, we are going to post all of this information to our website in case you missed any of these questions. Just go to WFMYnews2.com. It will be in the To Your Wellbeing section.